Good morning, everyone. Hi, Stefan.
Good morning. Good morning, everybody.
Great. Okay, so we can hear you great. Thank you. So, Stefan, Giles mentions just now that there is a fundamental disconnect between the expectation of continual availability of essential plasma therapies and the availability of plasma to manufacture them. Over the past 20 years, the private sector has contributed significantly in growing plasma collection in the EU. Out of the 8.4 million liters of plasma collected today, the private sector collects 46% of it, mainly through plasmapheresis, and in only 4 EU member states. The remaining 54% comes from the public and third sectors, recovered mainly from whole blood donations. But 8.4 million liters of plasma is not enough to meet the EU patient needs. We also need to import 40% from the US. How does the European Commission foresee the SOHO regulation to contribute in lowering the EU's high dependency to US plasma and strengthen the European Union's open strategic autonomy?
Thanks a lot. Thanks for the introduction, and good morning, everybody. I very much regret that I'm not with you in person. I'm going to set up my headset. If not, I hear myself speak again. So, and thanks for the introduction. I think, first of all, we really do fully recognize and thank for the important role that the private sector is playing in contributing to the plasma collection, as well as in the eventual manufacturing of the plasma-derived medicinal products. First of all, though, when we look at the actual work and the subject of discussion today, the SOHO regulation, it is important to manage our expectations a little bit. I think it's important to keep in mind that the role of this SOHO framework is only a supportive role. It is about ensuring safety and quality of plasma and plasma-derived medicinal products. It is not about how we organize the collection of plasma in the European Union. Of course, it has an impact on that, but I think it's important to keep in mind that the EU as such has no mandate in how plasma is collected in the member state. As you laid out before, there indeed, those decisions are taken at member state level, and in all the member states, there's a role there for the public blood services, and as you laid out before, there's 4 countries in particular that also have given a role there to the private sector. As European Commission and as EU legal framework, we stay very neutral towards that. Our rules are on safety and quality, and whoever is organizing the collection of plasma, we are expecting them to comply with those rules. Now, that being said, I think those safety quality rules can contribute to some facilitating or making it a bit easier to collect or import plasma. In the first place, I think there's a lot of room and potential for harmonization. First of all, across the European Union, between countries, how the safety and quality is assured, and therefore that facilitates the exchange of plasma and other SOHO across borders. And secondly, also harmonization with other legal frameworks, in particular the pharma framework, where, as the particularity of this sector, there is a really need to make sure that the flow of regulation is well and of requirements, so that the flow of the plasma into the plasma-derived medicinal products can also go smoothly. And a last element I wanted to underline from the legal framework is the importing provisions, which we actually are already quite well set up in a good coordination between the SOHO and the pharma frameworks, and that relates to the whole work of the colleagues on the plasma master file. That part will not be touched and is now fully recognized also in the SOHO framework. So I think that to start would be a couple of points that I would like to put on the table.
Thank you, Stefan. And thank you for reminding us that the SOHO is actually about safety and quality. And the SOHO regulation is actually an example in the shift of approach. In the past, directives were more oriented towards safety of patients, and SOHO now has donors in the heart of the regulation. For the collectors of plasma and manufacturers of DMPs, donors' health and safety is of paramount importance. The SOHO, however, covers many different substances of human origin than only plasma. Plasma donation via plasmapheresis is a safe procedure with extremely rare occurrences of donor adverse events. But different SOHOs imply different risks. And at the moment, the proposal classifies, if I may say, some donations as more risky than others, including plasma donation. Looking ahead and considering future-proofing the legislation, instead of making a prejudgment of which donations are risky, wouldn't it make more sense to evaluate the risk of SOHO donations based on donor adverse occurrence detected by the SOHO entities and part of their vigilance and reporting requirements, which is also foreseen into the proposal?
Thanks a lot for that question. First of all, indeed, the donor protection has become much more indeed at the heart of the regulation. It has become much more important. Donor protection was not at all foreseen in the current blood and tissue cells directives. But I think we all agree that it needs to be really central to ensure a sustainable supply. I think we all agree that the donors need to be reassured that we will in first place also take well care of their health. That being said, so the donor protection is introduced, and with that a couple of specific measures, in particular screening for the health of the donors, make sure that serious adverse reactions are reported. Many things that are actually already happening on a voluntary basis today, even if it's not mandatory or required. What I think I want to slightly correct is that plasma collection would be considered as a risky donation. I don't think that's what the proposal said. The proposal said there are a couple of risk factors that need to be taken into account for some donations. And one of them is frequent donations, and I think what the proposal refers to is not to plasma collection as such, but to frequent plasma collections from the same donor. Like it would also refer to some other SOHOs. Some risk factors are, for example, a surgery, or pickup of egg cells, or the need to give a donor medical treatment before he can make a donation. And for those kind of risk factors, we are expecting an extra layer of protection of donors in form of monitoring the donor's health and some specific measures. But I think, as far as I understand, that is already also current practice in your sector. I think you do regularly extra monitoring, for example, the level of genes in the donor. So it's not necessarily something that would really have a strong impact. And then, of course, as you say, the real technical details, they will have to be worked out later in technical guidance.
Your sound is also breaking a little bit. It's not just my voice. Yeah, indeed, monitoring is standard practice in the sector because it's important for us to gather data on donor health and ensure that donors are safe. So yeah, it was more on the reference at the moment of frequent plasma donation implying significant risk, contrary to the data already in place, showing that frequency, which is regulated, has no impact in the donor's health in the end. But moving on, you mentioned before that collection systems is not within the mandate or the remit of the EU to standardize collection systems. This is up for the member states to decide. But there are certain general rules that will set those frameworks. And unfortunately, from the launch of the proposal, there have been strong views expressed throughout the public debate, and in particularly in the negotiations within the European Parliament about ethics, focusing only on whether or not nationally regulated small fixed rate allowances as part of a range of compensation options will be are ethical or not. And as we are drawn into this debate, we are losing sight of the ultimate goal and the purpose of the regulation, which is about safety and quality. Data collected from the 4 EU member states where the private sector works alongside with public and third sectors show that more plasma is collected. And in those 4 countries, fixed rate allowance is regulated and is allowed. Do you consider, from the Commission's perspective, that compensating donors with a small fixed rate allowance is compatible with a voluntary unpaid donation, or is it unethical? And do you consider that the European Commission's proposal regarding compensating donors was balanced on donor safety versus patient access? How do you see the debate as the debate evolves? Would you consider that patient access to PDMPs may be jeopardized if we are going into models of prohibiting fixed rate allowance and compensation will completely be excluded?
Mm-hmm. Thanks for bringing that up. First of all, I don't think it's up to me to make member state-specific comments to say which country is doing well with what practice or not. But I think if you look at our Commission proposal, it does indeed propose to foresee some compensations that can be possible with fixed rates. We expect those fixed rates then to be set and defined by them at member state level for the different types of donations in a way that they are financially neutral. And financially neutral means, in basic language, that of course they should take away the barriers for donation. They should finance should not be a barrier to make donors to make a donation, but it should also not lead to a situation where this becomes an income or more than just a compensation for the donors that are deciding to make that donation. So I think that's our Commission proposal. Before we made that Commission proposal, I think we really have reached out a lot to the field, and both sides, I think, in the private as well in the public sector, and we felt that for both sides there was this was a kind of acceptable solution that could move forward. That being said, I think it's normal that also this debate needs to take place in the European Parliament. I think, and to end, I will say something that I think I said already 2 years ago on this debate, that we are expecting and we are seeing a lot of debates in the European Parliament on this point, but in the end, because there's so much debate, it means again that the two views are on the table discussing, and because we did that exercise before making our proposal, we really expect that the final proposal will be quite close to the Commission proposal. But okay, that's me speaking at this point. Of course, we need to do the trialogues and the whole discussion.
Thank you very much, Stefan, for the clarification. And now I will pass the floor to my colleague, Dominika.
Good morning, Stefan. So I'm going to switch gears a little again. Thank you for being with us today. So I would like to touch upon the EU pharmaceutical legislation. So certainly another big, very, very important framework within the Union that's being revised. So the initiatives that are presented in the framework will, of course, affect the entire pharmaceutical industry in Europe. Specifically for us, it is going to be impactful because it's going to affect a range of provisions, as you mentioned, in the plasma master file and otherwise. But Considering that this is not the only framework that is being revised, we saw in place since last year the new EMA mandate implemented. Now we are going through the motions of the SOHO regulation. Has actually the Commission evaluated the combined impact of actually 3 legislations that we are going to be governed under on the PDMP manufacturers on our sectors? Certainly, I am aware impact assessments have been conducted. So, can you perhaps give us a little bit of feedback on that?
Yeah, indeed, we do in our standard approach, Dominika, we do assess the coherence between the different legal frameworks. But of course, some things here had to be geared quite quickly. I think the EMA mandate in particular was really a reaction also on the COVID crisis. That being said, I do feel that at least between the services, between EMA and the Commission, between the pharma authorities and the SOHO authorities, there is really quite some dialogue, and I would say even an increasing dialogue. I think somehow COVID was a good occasion for that. I think thanks to COVID, we really have been coming together much more and been thinking practically also how what we can do to align the frameworks further to make it easier for you. I think we have got those discussions on the inspections in third countries, the remote inspections, some donor criteria were reassessed. I think that's the kind of interactions we have seen at that moment. And what you will see in both the frameworks, the SOHO proposal and the pharma proposal, is that we are trying to really embed that kind of collaboration in the 2 frameworks. Both of the frameworks are now having some provisions that really call for the respective authorities to reach out and coordinate their views on specific regulatory questions, and to do that already at national level and also where possible or needed at European level. So we have brought that approach into the 2 proposals, and of course then we also want to build further on some good experience from the past. And I think one good experience is the Annex 14 of the GMP, which really have laid down for the collectors what kind of expectations there are from the manufacturing side. And I think that is a really good approach that we also want to build further on. So I think, yes, we are trying to really keep everything harmonized, but I must also say it's not always easy with the high pace of developments.
Yes, I think I think this is certainly what we are seeing, and we are very grateful that attempts are being made. Harmonization is the key word, since our sector is being governed by both SOHO legislation and the pharmaceutical legislation. So going back to inspections, because obviously we are inspected by EU member states inspectors under the SOHO provisions, and also for the collection and the testing, and under the pharmaceutical framework for the manufacturing of PDMPs. So my question to you in terms of harmonization, are there concrete initiatives ongoing, for instance, to make sure that inspections are harmonized between the initiatives? Certainly 2015, 2016 were some initiatives ongoing by the Commission with regard to the implementation of an EU-wide risk-based approach to inspections. We see the proposal for wording of a risk-based approach to inspections in both SOHO and the pharmaceutical legislation. Are there concrete initiatives? Because again, once the framework is finalized, it's there. So obviously, is there any groundwork ongoing at the moment? Really concrete steps. I think it would be very helpful for our audience to hear that.
Yeah. Sure. Yeah, I think in first place, you're right. I think at this moment we are really putting the conditions in place to make sure that kind of coordination is better possible. So I referred already to this mechanisms of bringing the sector authorities together. But you're right. I think what is a big opportunity also is the fact that in the both frameworks now we are moving towards risk-based planning of inspections. Now, at this moment, it is too early. We have not really defined really how the risk-based planning will be done, but we are certain factors will play a role, like the history of a site, the volume of the site, and etc. That being said, we have within the framework today, we have already a dedicated group of experts that comes together from the different SOHO authorities in Europe. They're called the Inspection Expert Subgroup, and it's exactly their mandate to develop guidelines on different inspection elements, like this one on risk-based inspection. We know that that group is also in close contact with actors who do the same in the pharma sector, be it centrally in EMA, but also more decentrally, like in the PICS group. There is a subgroup under PICS that focuses on blood tissue cells, ATMPs. So those links are being made. So I think everything is getting in place to ensure that coordination better, but the concrete guidelines yet, I don't think they have been set yet on how that should be done.
Thank you. I think that's very helpful to know. Another point I would like to touch is certainly, as you mentioned, COVID has been useful for a few things, and one of them is certainly to highlight the need for the European Union to ensure stable and safe supply of medicines to patients who rely on them. And again, this is across the three frameworks. What we are seeing is a high emphasis really on reporting, on monitoring, on provision of data by the industry to the Commission, to EMA. So again, this has to do with harmonization and the provision of data. Are there any initiatives ongoing to make sure that there is that the burden of duplicative reporting is limited? Because of course, until the frameworks are in place, until the provisions are set out, it is likely that there will be some duplication. But I think over the course of the time, this is something that our industry is concerned about as we then report various data under the three legislations. Are there any concrete initiatives perhaps you can refer to that would coordinate a little bit in terms of what we report to whom? We have significant reporting obligations, for instance, both starting material as well as finished product under the PMF. We then have to report additional data under the EMA mandate and additional reporting under pharmaceutical legislation. So could you perhaps expand on that a little, to how to deal with the reporting burden? Are there initiatives ongoing?
Thanks. I think it's a concern that we really do acknowledge, and it's not a concern just coming from you. It's a concern that we see across the sector, the SOHO sector, and I think also in the pharma sector, they see the same, that we really need to be efficient on how data are collected and then used. And there's always a mantra that comes back. It's collecting it once and using it often. I think that's really what we have really in the back of our minds. And I think for the SOHO sector, that's in particular very important because, many parts of the SOHO sector, as you know, are public sector actors. So for them, it's very important that they don't get overburdened also with those administrative requirements. That being said, there are exercises ongoing under the pharma framework on data collection that follow the whole COVID exercise. There, you are familiar with the SPOC working group, the work of EMA in there. In our sector, you've seen also in the proposal, we are giving some specific attention to that, and in particular to critical SOHO, and also in there there's a role of the SOHO data platform that we are developing. So particularity, of course, that you have is that you need to comply with both legal frameworks, which is quite unique. I don't think there are many other pharma sectors that need to do that. So we are, I at this moment, the initiatives are both still growing on the two sides, but we are really talking to each other. And I think with EMA, we have regular dialogues. We talk about the different plasma-related files, including how the data can be better collected and connected. But beyond that, again, I need to give you a bit the same answer than to the previous question. We know this is coming. We are aware that in developing the two sides, we need to coordinate well. But it of course it hasn't. It's still not in place yet. So the real proof or the real way to make it efficient will only be able to come when we go to those next steps.
Thank you. And one final question, please hang on with us. Thank you for your patience. No worries. So certainly one of the big aims of the pharmaceutical legislation is to really make sure European Union is at the forefront of medicines manufacturing as well as innovation. And certainly, historically, this sector has been very, very strong in manufacturing of PDMPs in Europe. So how would you see that the SOHO legislation and the pharmaceutical legislation actually enhance or contribute to the standing of this sector within Europe and making sure that PDMP manufacturing and innovation by our sector remains in Europe? We have been seeing, historically, Europe has been at the forefront of manufacturing. Now we are seeing that this is slightly moving away. This is perhaps more, your thoughts on that.
Yeah. Thanks, Dominika. Well, just to first re-emphasize the mandate of the legislation, both pharma and so is really about safety and quality, to reassure that there is good safety and quality. That being said, I really think that Europe globally is recognized as having good safety quality therapies and being able to deliver those. And that, I think, really brings an advantage for the manufacturing capacities within the European Union. If we make clear that we have up-to-date and good working safety and quality frameworks. Another element I think that will play a role in that is, of course, is the increased harmonization. And I think for pharma, the harmonization is much more established than for SOHO. But I think with the SOHO proposal, it's a regulation now, and many of the actions in there are really aimed to harmonize more the field. I think that will also be a real benefit for the manufacturers. And a third element, again, I want to underline is this, and it links back to the coordination between the two frameworks we mentioned before, is also this importing requirement and the fact that we have a whole system of the plasma master file set up that makes it quite easy for outside plasma to come into the EU for manufacturing. So I think that there are across the framework some elements, but I think in essence, the fact that we are able in Europe to have good functioning safety quality frameworks is in essence a core value, I think, for the manufacturers based in the European Union.
Thank you very much. I do not have any further questions. I don't know if we have time, or are you available for questions from the audience? I don't know if this is, or I think we are finished. So Stefaan, Thank you very much from us here. I'm trying my best, but I realize you're very busy. Again, thank you for your time. Thank you for being available. And we would have loved to have you in person. Unfortunately, maybe next time. Thank you very much. Bye-bye.
I would have loved to be in person in Lisbon, of course. But
it's really nice.
Good.
You are missing
I'll hear
a lot
about
of fun.
it afterwards.
Thank you. Bye-bye.
Have a good time. Bye-bye.